You know, one of the largest populations that we've been able to help and serve are those people who experience chronic pain. And that's really pain that lasts beyond 90 days. And usually it's attached to mind-altering substances such as hydrocodone, oxycodone, and they've gotten out of control. And they also are using alcohol and other drugs. And these are people that in many respects have failed to launch. They're not able to get out of bed. They're not able to go to a son or daughter's wedding, or they're just not able to thrive. And when you work with chronic pain and substance use disorder and mental health, because 98% of all these people also experience anxiety and depression, you really have to enter into them and into the family a different way. Haven't you had that experience?
Well, you bring up a great point too, because we want to learn as much as we can about the individual. And we often talk about something called dual diagnosis or a co-occurring disorder, which means you have somebody that has depression or anxiety together with a substance use disorder, or perhaps there's alcohol and alcoholism involved.
And I think what we're really good at is coming up with that initial assessment about what would be the three best places, who has the best staffs in the country to handle that particular issue.
And that's why we want to learn as much as we can, because for instance, if we're working with a young adult who really loves to be outdoors, we'll think about a place that's more experiential. Maybe it's important for him to hike, or maybe it's important for him to work with equine therapy and the horses. We really, there's no cookie cutter approach. We can customize treatment to the individual to make sure that they have the best possible chance of success.
And as we talked about chronic pain, we want to make sure that the facility has a chronic pain specialist, that they also follow the CDC guidelines, which are 7 different things, that there is movement, and that there are specialized groups for people that are able to relate to, who also have a physical malady as well as a substance use disorder.